And so taking a look at it by race and ethnicity, we see when examining chlamydia rates among teen ages 15 to 19 for 2019, a disparity exists among Black teens, with their rates being higher than the state rate and nearly 3 times the rates of white and Hispanic teens. Again, when examining gonorrhea rates among teen ages 15 to 19 for 2019, a disparity exists among Black teens, with their rates being higher than the state rate, as well as nearly 5 times higher than white teens and 11 times as high as Hispanic teens. So you heard about our state rates, and now I wanted to share this fact sheet with you. And if you would like a copy of this fact sheet, you can visit our website at emP.O.W.E.R.ed. But it goes to kind of go into a deeper profile of some of the things that I mentioned. So as you can see here, so Orangeburg is ranked 23rd, so that's, you know, not too bad. But when we look at the rates of the cases, there, Orangeburg County is ranked number 8 for chlamydia and number 14 for gonorrhea. And so we want to make sure that we are addressing these concerns in the county. And so one way of doing it was to apply for a funding opportunity to work particularly with Orangeburg County as well as Richland County. And so back in March, we approached or looked at this funding opportunity that was through the Office of Population Affairs. And some of you on the call, you may have received calls from us as we told you about the project. We hosted a webinar that explained the project to see if anyone would be interested. And we did have some interested partners in Orangeburg County that's on the call today. And so the purpose of the funding opportunity was to establish and support a multidisciplinary network of partners to develop and test innovative interventions in your county that would have an impact on optimal adolescent health, teen pregnancy, and sexually transmitted infection and rate disparities. And so we at FACT-Forward, we chose to focus particularly on youth access to and experience with sexual health care based on the numbers that you've seen before. So the high rates of STDs, the high rates of teen pregnancy. And so we would hope that if we could increase access, because we know access is a huge barrier to a lot of things, especially for rural areas, if we could increase access to and experience with sexual health care, we would hope that STD rates and STI rates would decrease as well as birth rates. And so the emP.O.W.E.R.ed SC was funded by the Office of Population Affairs, and we were funded at $1.8 million. And this is a 3-year project. And so we would hope to invest a large portion of those funds into Orangeburg County. And so I would like to say that my team at FACT-Forward, we were one of 13 agencies across the country to receive this funding. So this is great news, not only for FACT-Forward, but for the state of South Carolina, as we were able to receive, like I said, $1.8 million. And so this is where we sit. There are other organizations around the country that are focusing on other key priority areas, such as youth with disabilities, youth engagement, working with caregivers, all to increase the optimal health for young people. And so just to give you an idea of what the project entails, as I said before, the key priority area will be, we will be working with young people. And we would hope that some of the individuals on this call, some of the agencies that's on this call, will create a multidisciplinary network to create multiple innovative interventions. And so you may be wondering, well, what's an innovative intervention? It's something novel, something new that can address the concern that we're trying to address, which is to increase optimal health among our young people. So you'll hear some of my colleagues later today kind of go into depth about some of the things that we would like to do in your counties, but we would also like to hear from you throughout the day as to what are some things that you think that should be done in your county. So as you hear me talk, please utilize the chat box if you have suggestions or if you have comments or concerns about the work that we are proposing in Orangeburg County. So what does this investment look like in your community? So you heard me talk about the $1.8 million that we received for year one. So what does that look like for Orangeburg County? Well, we created emP.O.W.E.R.ed SC with 4 major components. The first component you see here is mobilization. So we never like to just tell a county that we're coming in, but we want to mobilize the community, mobilize the county to influence the development of innovative strategies to increase access and linkages to sexual health care for young people in your county of color ages 15 to 21. Another big component of the project will be innovation. So this is the opportunity to explore and develop innovative interventions within your county. Next, we would like to focus on implementation. So implementing educational interventions, whether through high schools, college campus, as well as providing some of those educational interventions to parents and other trusted adults in the community. And lastly, after mobilizing and creating innovative interventions and implementing those interventions, we want to make sure that we evaluate the impact that the investment has on the community. And so you will hear from my colleagues in a few as they kind of go into depth about those 4 components of the project. And so to tell you about who's a part of the project as a whole, this slide shows you the network of partners. So who we propose to work with are the health centers. And so the health center in Orangeburg will be DHEC. And so we would work closely with both the DHEC in the city of Orangeburg, but as well as Holly Hill to meet those students that are in that Santee, Holly Hill, Utahville area. We would also like to, using a systems thinking approach, we don't just want to focus on health centers, but we want to focus on the community as a whole. So we involved high schools. We would like to work with high schools, college campuses, community partners. So if you are a community partner on this call, we would love to work with you. If you know of a community partner that's not on this call, but you think should have been on this call, please use the chat box to let us know who we need to reach out to. And a huge part of the project is a community health worker. So we see that the health center sits in the middle because remember, as I said before, our main priority or our goal is to increase the access. And so we want to increase access to the health center. And so we'll do so by also utilizing a community health worker that will work with the community and go out into the community to educate the community, tell the community about the resources or the services that the health center provide. And in doing so, some of the college campuses that we are anticipating working with includes Claflin University, South Carolina State, Allen and Benedict, which would be in Richland County. And so we wrote particularly to work with historically Black colleges and universities for this project as we're focusing on youth of color. Our network of partners as it relates to health center includes, as I said, Orangeburg DHEC, and we're doing this same project in Richland. So we'll be working with Richland DHEC as well as Eau Claire Cooperative Health Centers. And then we'll be working closely with Orangeburg County School District to work with the high schools in those areas to test some innovations and utilize some other programming with their young people. And then lastly, we'll be working with community partners. And so we would like for the community to tell us who are those organizations that are known in the community so we can begin working with them. So after I speak, you will hear from my colleagues as they go into details about these components that you see here and how they all work together. One thing that I did forget to mention is that we also will be working closely in creating a community advisory group. And my colleague Meredith will talk more about that as she comes up next.
Thank you, Brittany. Thank you. That was a good introduction to the great work that we'll be doing in Orangeburg County. So when I graduated from college a long time ago, Coretta Scott King was the commencement speaker, and she closed her speech with a quote, "When a collection of brilliant minds and talents and hearts come together, expect a masterpiece." And even though we don't know the origin of that quote, it kind of sets the tone for the community mobilization and the community advisory group that will be created for this work. So community mobilization is seen as the foundation of any type of long-term change. The community advisory group for this project is the main source of stakeholder engagement. So we intentionally use the word advisory because you all are from Orangeburg. You all put the stars on there. You work in Orangeburg. You live there. You play there. You know your community. So for this project, you'll serve as a thermostat and a thermometer. We want you to take the temperature of the community, but also set the temperature and set the tone around this priority area, which is youth access to and experience with sexual health care services. Next slide, please. So when we think about the expectations of any type of community advisory group, everyone wants to be a part of the community advisory group. Everyone has something to say, but we are really going to lean into and be influenced and informed by the collective impact model. And in that model, you just don't create a shared vision, but there also has to be shared accountability. We really would prefer 10 people who are really willing to show up versus 30 people who want to come and dump opinions and then leave, but really haven't been invested in this project. So shared accountability is going to be a really big part. Another huge part that Dr. Rena Dixon is going to talk about later is innovation, but this group will really guide and influence the innovations that are happening. Those are the new things that Brittany talked about, but then you'll also think, you know what, somebody's already doing some great work in a small corner that we think that could benefit the entire county. So that's when we talk about really guiding those innovations. What is happening nationwide? What are some things that are happening across the country that really could be utilized here in Orangeburg County? The next expectation is developing those community messages. I'm originally from Chester County, so I can tell you what messages need to go out in Chester County that will resonate with the residents here. You are from Orangeburg County, so we really want you to have an opinion and really take the lead and work with a wonderful young lady who will be joining our team to really create those messages specifically for your community. Next, we want you to contribute to a social network analysis. In layman's terms, that's some investigative work to look at some social structures and then look at how they link together. And we'll do that twice. Jennifer will talk about that later. And one of the other things you'll do is identify new partners. Who's at the table now, but who's not at the table? We really want you to think through the voices that you've heard in different points when it comes to adolescent reproductive health, but not only speak for them, we want you to bring them at the table so they can speak for themselves. So as I close out, I want you to think, like, in addition to the college campuses and the community partners, you know, in order for this community mobilization work to be really rich, we need young people at the table. We need faith leaders at the table. We need business owners at the table. I want you to think about those people who are community influencers or change agents. Even though they don't have a formal title, they're beneficial to this community advisory group. So I look forward to working with everyone on everything that you've heard today. You'll hear a little bit more from Brittany about who we're looking for and who we want you to think about who needs to be here. And that's all that I have. If you have any questions for me, put them in the chat box. I can answer some of those later. Again, my name is Meredith Calford, so you can find me on the website if you want to shoot me an email. And so next, I'd like to turn it over to Dr. Rena Dixon to really dive into what we mean when we say innovation. Next slide.
Thank you, Meredith. So when we say innovation, I think that can kind of be an abstract term for a lot of people, but this is an exciting project because we have the creativity to be able to try new things. A lot of times if you worked on projects before, it's very structured. It's very, here's what we're allowed to do. We're just replicating a project or a program. And now we have the ability to actually create interventions that we know are gonna work for our young people. I know many times even when I was working in the field, it was, wow, I really wish that we could address this, or our young people really need that. And this is an opportunity for us to create interventions that work for young people, and especially our young people of color. So what we're doing, Brittany mentioned earlier, we're making a very large investment in Orangeburg County. And this year we're gonna be giving out $875,000 to community partners across Richland and Orangeburg. There are going to be several ways that you can be a part of the project through implementation. Katrina is going to talk next about implementation partners, but I want to focus on our innovative partners and community sponsorships. Now, when we say community sponsorships, if you're familiar with the work FACT-Forward has done for many years, if you know May and October, we always give out community sponsorship grants to do awareness events. That's going to continue. We're actually going to do it 4 times a year. So if you really just want to have a one-shot event that works in the community with young people during Let's Talk Month for parents, or you want to work with young people during May for Sex Ed for All Month, or Teen Healthy Relationship Month in February, that is definitely the pot of money for you. There'll be small grants available, and you will be able to do a one-shot event in the community. We will help you get swag and all other kinds of fun things for your young people or parents attending that event, as well as offer opportunities for technical assistance. Now, if you want to dive a little deeper and you want to actually implement a program, let's say it's a program that you've been implementing and you need some money to continue the implementation of that program that's proven effective, then we will be able to provide an implementation partner grant opportunity for that. There'll be an application process for all of this. And you are happy to drop your name in the chat if you're interested in applying for any of these. But implementation partners, you guys have long, maybe you want to work with young people over a 6-month period or an 8-month period with the program that you already have running. We will provide you with training and technical assistance in any needs. And those grants will be a little larger than the community sponsorship grants because they're multi-session type deals. Now, the largest grant opportunity that we're offering outside of our program partners is an innovation partner. And this is where the fun stuff comes in. But this is going to take a lot of time. So we're asking people to apply to be an innovation partner if you have the time to creating a new something that you want to work with young people on. We'll be leading you through a design thinking process where we help you tease out what your ideas are. And then you'll move into our learning collaborative, which we affectionately call CREW, which is the Collaborative for Reproductive Education and Wellness. There, we're going to teach you quality improvement of how to test your idea. So you're going to actually get to implement it and then come back, collect data, make some changes, go back, do some more implementation around whatever idea it is that you have, along with our program partners who are also going to be participating in CREW. If anybody, I think some of my Orangeburg DHEC folks are in here, they know we have a good time in CREW. It's a fun time to participate, and it's my baby, so I'm a little biased towards CREW. But those are our opportunities for funding in Orangeburg County. There will be a invite sent out in a couple of weeks if you're interested in applying. So please drop us a note in the chat. Let us know if any of these sound appealing to you or you want more information, and we're happy to set up a call to talk to you more about each network. And Katrina, I think it's your turn.
All right, I'm going to talk a little bit about implementation. Brittany, did you want to go over the chart before I go into implementation?
Sure. So this is our network visual, just to give you an idea of what it looks like as we talk about the different components. And so the blue boxes here, this is all of FACT-Forward staff. This community advisory group, this is what Meredith just mentioned. This group will kind of advise or influence the work or influence some of the strategies that will be implemented into Orangeburg County. And then here we have identified high schools, and Katrina will kind of tell you what are some of the programming and implementation that will be done in high schools. As I mentioned before, historically Black colleges and universities and the programming there, Katrina will talk more about. Here you see a Title X clinic, and so that's just a fancy name for DHEC, or a federally qualified health center. And they will employ a community health worker. As you can see, all of the arrows here are directing directly to that community health worker. And so that community health worker is primarily working on the work that we're doing here. And so Katrina will talk more about what it is that they'll be doing. Here, this is where the community partners come in at. So if you are a high school, and I think we have some representatives from Orangeburg County School District here, or our HBCU, I think we have representatives from Claflin. If you have community partners that you already work with and you say, hey, I think they will be a great addition to this project, please let us know. We don't like to come into a community or a county and tell you all what to do because that's not sustainable. So we want to hear from you, and you tell us, or you identify who are those community partners that we need to be engaging with. And so those are those individuals that sit here. So who are those pillars in the community? Not just the city of Orangeburg, but the county. So that's why we talked about the county. Like I said, I'm from Santee. I went to Holly Hill Robertson. I graduated from Lake Marion High School. So I understand the rural side of Orangeburg County as well. So who are those barbershops? Who are those faith-based institutions that have a great relationship with young people and not afraid to have these conversations with young people? Here you see rideshare. And so I know some of you are like, now Brittany, there's not no Lyft or Uber in Orangeburg. And so we have the opportunity to partner with something called Circulation Health that can work with the health centers to send transportation out to young people to get to where they need to go. So it's almost like the Medicaid van or the Medicare van, but it's a car like Uber or Lyft. And so those are some of the innovative things that we are trying to bring to Orangeburg County to increase access.
Thanks, Brittany. On the other side of what Brittany was talking about, I'm gonna introduce myself again in case some people dropped in after we did introductions. But my name is Katrina James. I'm the Health Services Coordinator with emP.O.W.E.R.ed. My job on this screen is to provide capacity building and technical assistance for those partners that we will be implementing these projects into. So that'd be health centers, health departments, colleges, community partners, high schools, and other people on this project. I basically am that resource to you all to kind of make sure you understand what's going on and have what you need. And so when we talk about implementation, we're going to implement and test something called emP.O.W.E.R.ed. emP.O.W.E.R.ed has 3 different components, and it's high school, college, and parents. So I'll start with emP.O.W.E.R.ed high school. We want to implement and test that program to determine if program participation can lead to an increase in the number of youth of color who access sexual health services post-completion, and if this program could potentially be scaled up to meet requirements for the South Carolina Comprehensive Health Education Act. And I'll go into, after I finish describing this visual, I will describe exactly what emP.O.W.E.R.ed is. And when we implement and test emP.O.W.E.R.ed College, that program is going to be within HBCUs to determine if the program participation can lead to an increase in the number of youth of color ages 18 through 19 who access sexual health services post-completion. With emP.O.W.E.R.ed Parent, that program is going to determine if participation can lead to an increase in the number of parents who discuss sexual health with their youth. The next component is going to talk about a little bit of peer education. We want to develop, test, and refine that training curriculum to utilize high school and college students to facilitate access and linkage to sexual health services. The other component we want to do, and that's when we talk about our health centers and our health department, we want to implement, test, and refine the utilization of a community health worker. And we want them to identify youth of color's sexual health and other identified needs. Community health workers will utilize something called the Rapid Assessment for Adolescent Preventative Services, RAPS, to facilitate linkage and access to sexual health services at Title X clinics or federally qualified health centers. And the last component we want to talk about is telehealth. And I know a lot of places are doing telehealth, but what we want to do with telehealth is develop, implement, and test that telehealth coaching and those services for youth within the identified clinical settings that be Title X or our FQHCs. All right, next slide, please. All right, and so I did want to talk a little bit about what emP.O.W.E.R.ed is. So what emP.O.W.E.R.ed is it utilizes media literacy education to engage students by harnessing their interest in the popular media. emP.O.W.E.R.ed seeks to deepen students' understanding of the influence media has on their decisions and helps to provide their critical thinking skills related to media, sexual health, and relationship health. emP.O.W.E.R.ed is convenient for students as it's accessed online and is completed on their own time at their own pace. What emP.O.W.E.R.ed College addresses is birth control methods, sexual assault and consent, alcohol and substance use, risky sexual activity, STI prevention and testing, bystander intervention, stalking, dating violence and abusive relationships, gender role stereotypes, effective communication with romantic partners and health professionals, media portrayals of romantic relationships. So if anyone is interested in reviewing the curriculum after this webinar, please let us know via the chat box and we'll get this information to you. You can also email myself or Brittany Waring. You can email Brittany at bwaring@factforward.org, or you can email me at kjames@factforward.org. Brittany's information will be provided at the end of the webinar, and I will drop my information in the chat as well if you want to get any more follow-up information on Media.O.W.E.R.ed. I did have the opportunity to view the Media.O.W.E.R.ed curriculum, and it's very interactive. I actually was a little surprised at how interactive it was. I was like, oh, I wish I would have had this when I was in high school or college. It's very educational in a more modern format. So if you do want a little bit more information, let us know. If you have any questions, drop it in the chat. I'll be happy to answer. And I think we're gonna go next to Jennifer with some evaluation and how all of the things that I just said will be evaluated.
Thank you, Katrina. And I'm going to do like Katrina just did. For those who relate to the call, I am the Research and Evaluation Manager here at Fact4Ward. And as you just mentioned, I'm going to talk about our role currently in evaluating all the different interventions. So as Katrina just mentioned, the emP.O.W.E.R.ed SC project is a large multi-component project that's being implemented across 2 project counties, as was mentioned. Today we're focusing on Orangeburg, but this will also be occurring in Richland. So as the components were shown, all project innovations will need to be evaluated. So internally at Fact4Ward, we will be responsible for the development of data collection tools such as participant pre, post, and follow-up surveys that are associated with the Media.O.W.E.R.ed programs. And as part of the project, we are expected to reach over 4,000 youth and with the Media.O.W.E.R.ed colleges and high school programs, and approximately 800 parents who will participate in the Media.O.W.E.R.ed parent program. So internally, we will be responsible for collecting all that data, tracking and monitoring this, and basically ensuring that the program is being implemented and ensuring that we collect all the participant data for those. We will also be responsible for developing data collection tools for our clinic partners to measure clinic outcomes such as the number of sexual health visits, the number of birth control methods prescribed, the number of STI tests performed. And these are just a few examples of things that we would like to track. We'll also track things that are tested and developed through CREW. So we'll have a role in looking at those different measures as well. We will also assist in the development of any data collection tools needed for any of the innovations that were proposed. And then we'll also assist any community partners in any way possible to help, develop tools to measure the outcomes associated with the program. One of the other things that we will be responsible for is collecting and reporting on the Office of Population Affairs performance measures. For those of you who may not be aware, OPA has required performance measures for their grants, and each grantee is required to submit data via the required data reporting system on a semi-annual basis. So internally here at Fact4Ward, we'll be responsible for doing that. And just for example, for those of you who might not be familiar with some of the performance measures, some for the project, just to name a few, are things like how many youth were engaged, how many parents were engaged, how many community members were engaged. So it really kind of hits on like all the different activities between the CAG, the different programs, and all the innovations that are being tested. So we'll be measuring all of those things as well. And we'll also be looking at the number of innovations that are being developed and how many are in total are being counted and in what stage of development they're in. So if we're testing, refining, or evaluating the different interventions that are going to be proposed or already planned to be performed in Orangeburg. And lastly, we're going to collaborate with Randy, with Philibert in Research and Evaluation. And basically, we will share all of our innovation data with her, as they will be serving as an external evaluator. So she's really going to help us see, of all the different interventions, do we actually see an increase in those youth who access sexual health services? So at this point, I'm just going to turn it over to Randy, and she's going to tell you more specifically about what Philibert's role will be on the project, and also some upcoming activities that will happen in Orangeburg.
Thank you. And for anyone who joined late, my name is Randy Berlew, and I'm a senior evaluator with Philibert Research and Evaluation. We focus on program evaluation. We do that pretty much exclusively, and we've been working on these OPA projects for the last 10 years. So we're really excited to be on board with FACT-Forward for this project. And as Jennifer said, we'll be doing a lot of collaborating with the research team at FACT-Forward on looking at appropriate data tools and thinking about measurement and coming up with ways to provide evidence that the innovative strategies that come out of this grant are having an impact on youth of color in the community. There are a couple of things that we're working on right now that hopefully you'll hear about in the community and hopefully you'll advocate for. The first is a community survey. We had initially thought that we would sort of get youth to do this survey door to door, but because of COVID and wanting to keep everyone safe, we've had to pivot a little bit. So what we've been working with FACT-Forward on is coming up with a youth and a parent survey that we are going to give out by phone and by email to youth in your community. So they'll be hearing from us in the next couple of weeks via postcard to let them know that it's coming and that it's accessible by email. And we will be following up with phone calls to parents to ask them to participate and to consent for their youth to participate. And really the purpose of this community survey is to really get information from the community about how they're viewing these issues and what strategies and solutions they think would work best with their youth. And so one of the commitments of the project is really to be community driven. And this is one of the ways that the community will have a voice in informing the group about the strategies that they feel are most appropriate for their community. That data will be summarized and shared with FACT-Forward and in some form shared with the community advisory group too. The second thing that we're working on right now is a social network analysis. And this is really going to focus on what is happening with the community advisory group and the synthesis between all the partners. And we'll be looking at very closely how working together as a network increases the impact that any one group could have individually. So we'll be doing surveys and interviews over the course of the project to look at relationships within the collaborative and also to look at the impact that the collaborative is having on youth in the community. And that's another thing that we'll be able to report out to the community advisory group to help inform the work that gets done. And I think both of these projects that we're working on right now will also be helpful as the community advisory group is thinking about what partners might be missing in the beginning, who might be good to add on to the group, and the types of innovative strategies that really ought to be tested in the community. We'll also, as Jennifer said, be working on supporting FACT-Forward with some of the data analysis for the innovative interventions. We're always available to provide technical assistance on research and evaluation, and we'll be writing a series of reports over the course of the project to provide information to a variety of audiences, to the government, of course, for who is funding the project, but also looking at what are the best ways to communicate what we learned through this project to the community. So that's going to be our focus, and we're really excited to work on this with the team.
Thank you, Randy, Jennifer, Katrina, Rena, and Meredith for going over this great project. And so now we hear from you. And so we've done a lot of the talking, and I do not believe in just talking the whole time and not hearing from our guests. So I have an activity. And I don't know if you can see my screen, but what impact, after hearing about this project, I want to know what impact do you think empowered SC will have on the community? So I don't know if many of you are familiar with a polling technology, but I want you to take out your phones and I want you to go to www.menti.com. And I'm going to do it with you. And what this is going to do is create a lovely word cloud that I will keep. And so as we're working in Orangeburg County, be reminded of some of the things that you all mentioned. And so once you go to menti.com, you will put in that code that you see at the top, which is 6012 628. And then you will just write in your responses or type in your responses. And for those of you that are not able to do it, you can put your responses in the chat, and one of my colleagues will enter your response into, sorry, let's go back, into the system. So I see awareness, I see fun. There's a lot of innovation, increased access. And so this is real time. So as you're putting in your responses, it's creating this wonderful word cloud. Increased graduation rates. That's absolutely true. Education, power, helpful, success. Keep them coming. Lasting. That's very big. We want to make sure that the work that we're doing is sustainable. A lot of data. Okay. Lower rates. Awareness seems to be sticking out. I'll give a few more seconds. Different. Okay. Lasting. I said that. Community voice. I'm glad for whoever put that. That's what we want. Empowered decisions. I like that. Okay, any more? Let me check the chat to see. All right, so no more from that. And so what we would have hoped is by the end of this 3-year project, we will see some of these things come into fruition. And so I will definitely take a screenshot of this, or one of my colleagues will take a screenshot of this. And so we can be reminded as we're working with the community, as we're working with the county over the next 3 years, to be reminded of some of the things to look forward for. And so thank you all for participating in this activity. So another activity that I want us to do very quickly. I know it said from 2 to 4, but it's just 2:55, so we'll probably be done quickly. As you see on your screen, these are like paper planes. And how many of us used to make paper planes when we were in high school, or not high school, elementary school? Anybody ever made paper planes? And so the one thing that I liked about it was every time I made one, it never came out like the one before, right? It was always something different. Either I bend the paper before, this way before that way, or I didn't put the crease hard enough, or I put it too hard, or whatever it was, it always came out different. And so when we think about innovation, when we think about some of the interventions that we're trying to do in your county, think about the paper planes that we created, right? And so it just, a little tweak can make a difference. And so I want you all to either unmute yourselves to tell me what are some of the work, like after hearing about this project, that you think that can be done in your community. If you are one that does not like to talk, you can also use your chat. I'll give you about 2 minutes to either someone unmute themselves to tell us, what do you think, what are some of the interventions that you think that can happen into your county, or you can utilize the chat.
Hello?
Yes.
Hi. I can definitely see.
Can you introduce yourself? I'm sorry.
Hi, this is Kimberly Ray calling from Orangeburg County School District.
Okay.
And I envision better dialogue between children and parents, and us being able to help facilitate that. And I think that's really important, since parents are the first teachers to the children. So when we empower the parents, it's just going to be fantastic. These parents are definitely have more tools to approach their children and talk to them and have these conversations that need to be had. And then they'll also learn. And then hopefully the children will teach the parents as well. So I see all over just better communication between children and parents for this great conversation that needs to be had when it comes to reproductive health and preventing STDs and STIs and the whole gamut of it all.
That's so funny that you mentioned that, Kimberly. Fact Forward actually did 2 Let's Talk events on Facebook, and they were some amazing interviews. It was actually done by somebody named Brittany Waring, and she interviewed some parents. One of them was on parent-child communication, and the other was on parent-child connectedness. So if you have a network of parents that you would like to share it with, have them visit our Facebook page at FACT4WD.org, or they can visit our website and get to the page from the website. And so I appreciate you sharing of how the dialogue will enhance between parent and child. Anyone else that would like to share how do they envision this project working in Orangeburg County? Or what are some interventions, or what are something that you're looking forward to?
So this is Jim O'Grady with Orangeburg, with DHEC. I'm really excited about the prospect of the telehealth portion of this grant. That's something that in the health department in my area, we have never used before. And I think it would really open up communication lines between our staff and the teams in the area. So I'm curious to see how this works.
Great. We are too. It's all about innovation. Anyone else would like to share? Okay, so if you didn't share today but have a great idea, you can always email me, as my email was on the flyer. You can give me a call. If you are a texter, you can text me, and we can work with you all on getting started. And so now that you've heard about this project, what else should be involved, or who else should be involved in this project? So are you a pioneer? How many pioneers do we have on the call? That's someone that redefines the problem to break boundaries. Are you an ideator? Do you generate many ideas? Are you a connector? Are you that person that see things differently and then you can translate wild ideas? Are you a creative partner? One that can develop or refine ideas early on? Are you that key stakeholder in Orangeburg County? That's that person that can affect or be affected, right? Are you a sponsor? Are you someone that has power and ability to allocate funds and resources within the community, within the county? Or are you a builder? One that can build out prototypes or innovative interventions? Or maybe you are a pioneer and an ideator, or maybe you are all of these. How can you see yourself in this project? Do you know someone that's one of these things and they're not at the table, or they're not on this call? Can you share this information with them? So I see someone that says that they are a key stakeholder. Very good. So like, how do you see yourself working on the project? The purpose of this call was to explain what we're doing before we begin doing work in a county or a community. We never like to just start doing things without letting the community know it first. But I'm sure that there are a lot of amazing people that's in Orangeburg County that did not have the opportunity to join this call. So as you leave this call, or as you think about some of the things that we've mentioned, what role do you see yourself playing? Are you one of these individuals? And if you are, let us know so we can begin to engage with you to work with us on this amazing project. If you know someone that should have been on this call that did not get on this call, you can drop that organization in the chat box. You can let us know on the survey that we would like to, that we will give at the end of this call. And if you think, hey, Brittany, you know what, you should have contacted so-and-so because I heard that they weren't on the call, they would be a great addition to the project. We would love to hear from you because we're working in your community, so who knows best the community than you all. And so as we are nearing the end of this presentation, I want to talk about some next steps. And hopefully these next steps will involve many of you that's on this call. And so just to give you a little timeline of where we are going. And so as I mentioned at the beginning of this call, we were awarded in July. And so the Office of Population Affairs gave us 6 months to plan. And when I tell you it's a lot of planning, and we will take the entire 6 months to plan. Our planning period ends in December 2020. And when I say plan, I mean all of the work that you heard Katrina talking about, from the implementing media aware, who Denise that introduced herself earlier, she will be heavily involved in making sure that you're implementing media aware into your high schools, into your colleges. If you have a church that wants to implement media aware just for parents, have that church reach out to us. They can apply for a sponsorship, as Rena mentioned, or become an implementation partner. We'll be working with peer educators. And so Katrina kind of briefly mentioned, we'll have peer educators in both the collegiate setting and the high school setting, where we will work with those peers to co-create a curriculum that will be taught by peers for peers in the schools. And so if you would like to be a part of, you know what, we think that another topic should be included in the curriculum, we would love to hear from you. And so that's a part of planning. As Gemma just mentioned, working heavily in the health centers. So getting telehealth off the ground, that requires planning. So we are really excited about all of the amazing things that we intend to do in this project. Our goal is to begin implementing in January. And so implementing media aware into the schools, we understand that schools are convening differently, but the cool thing about our implementation is media aware is online. It doesn't require our students to be in a classroom. We will train our teachers to provide some debrief to students, whether they're engaging with students on Microsoft Teams or however they may be engaging with students. The same for parents. Media Aware Parents is an online program. So it fits perfectly with our new normal that we are experiencing because of COVID. And so I want to make sure that I don't think, if we didn't do a good job of this, I apologize. We will still adhere to all COVID guidelines, which is why we didn't have a big community kickoff meeting today, because I would have loved some free food, right? But we will adhere to those guidelines as we are doing our implementation and programming within the project. As Rena mentioned, our design thinking cohort begins in January. And so if you are a community member, or you know of a community member that has this amazing idea, maybe it's not an idea that's focusing on pregnancy prevention, but by coming to our design thinking cohort, we can kind of transcend it into becoming one. Let us know, drop those ideas in the chat box. We'll provide you with technical assistance and capacity building as we work to enhance that idea into something great. We'll start with peer educating trainings in March, and that will be trainings for both the high school students and the college students. Our crew learning sessions begin in April. And so those learning sessions will be where all of our partners on the project will meet, whether it's via Zoom or virtually or in person, and we'll learn and collaborate with each other to see what other partners are doing to address the priority area that we mentioned. And then in June, we'll have our Summer Institute Conference that we had every year, but we postponed this year because of COVID, where you'll be able to participate in some amazing professional development opportunities and learn from other partners that's doing similar work. And so this is just a brief timeline of all the many things that we would like to do as part of emP.O.W.E.R.ed SC. And as I mentioned before, it is a 3-year project. And by the end of 3 years, we would have hoped to have an array of interventions, whether they're designed for parents, whether they're designed for high schools. If you have a barbershop that says, you know what, I want to start talking to young men about the importance of safe sex, and they want to start a corner where they have information in their barbershop, that's an innovative idea. Tell them to talk to us, right? If you have a church that wants to start a parent group that talks about taboo issues, like we know that a lot of people don't want to talk about the issues that we're talking about, but why? It's needed. The data shows that it's needed. So any of those things that you think you just think it's just a a crazy idea, there's no crazy idea. We can always turn it into something great. And so this just gives us an outline of where we see ourselves going over the next 3 years. And so I'll stop here to see if I have any questions about what we discussed today. No questions? Nope. All right, well, I want to thank you all for your time today. And I know that I'm supposed to have my contact information, but I'll put it in the chat. And before you leave today, if you want to take a picture of the screen and it will take you to this survey will actually give us some additional information of who we need to reach out to. What was some of the information you would have liked to receive today that you didn't? And so if you could take your phone and just take a picture of the survey, of the picture, or you can go to the link that I have here. And complete the survey, we would really, really appreciate it. And if you don't have that kind of phone where you can just take a picture of the image, as I said before, I will leave this up here so you can type the link into your browser to go to the survey. And do any of my colleagues have anything in addition that they would like to add?
Thank you, everybody, for being with us today. We're really excited about working with you.
Thank you, Rena. All right, well, you all have an amazing Wednesday, and hopefully we'll be in contact soon. Don't forget to do your survey. Have a good day.